have all those other signs of headaches, which was my reason to get a tongue tie release, and it reduced my headaches by 75%, which is amazing. Or a acid reflux, or sleep, or a lot of other things that can help out with that. Then we'll look at doing it as an adult. However, before you free up the tongue and give it the freedom to move, you want to make sure it has the space to move into. So especially for adults. For kids, even if they're narrow, that tongue, because they are so malleable, is going to help create that space. In adults, if you free up the tongue, you can actually make sleep apnea worse, because now that tongue has that ability to flop back and block off that airway a little bit. So the tongue tie is part of the myofascial train system, and it runs from the tip of your tongue all the way down to your toes. And so if you stick your tongue up, it's that guitar string underneath your tongue. To just say, do I have a tongue tie? You probably do. Do you need to get it done? I have no idea until we go through all of the different reasons why you're wanting it done, the measurements, your sleep screening results, and a lot of different things there. And that's not even to go touch on the point of you want the strength and ability to, before you get it done with myofunctional therapy, and you want to continue that strengthening and that stretching after, so that it's a successful release and it doesn't reattach back.
That's awesome. Yeah, that's so important to realize that just because someone has a tongue tie doesn't mean that we just release it, right? We got to figure out, is this affecting you? Because if it's not affecting you, why should we do anything about it? Let's leave it alone, right? But if it is, and it's difficult to know how it's affecting a person until we've done all the screenings, right? Because I've had so many patients who are like, it doesn't cause me any pain. And I'm like, it's not going to cause you any pain right there in your tongue tie. That's not what we're looking for. We're looking to see what your tongue can do because it's so tied down, or what it can't do because it's so tied down. And is that affecting other things in your systems?
Well, when is that an issue and when is not an issue? So I'm going to tell you my opinion and my viewpoints with different things. So if you have a newborn baby and they're struggling to nurse, then take a look at the tongue ties and the lip ties and everything else like that to see if it's not allowing the lips to flange out all the way. And so the baby can't express the milk enough, or maybe the baby's expressing milk just fine, but the mom is in pain, and that's no fun either. So there's a few different reasons why. So as an infant, you can look at getting that tongue tie release, and they're able to get that procedure done fairly quick and painless with different things. Well, and then now you go into the next age group that might be that 1 to 4 years old, where now they might struggle a little bit. And are the benefits of getting a tongue tie release, do they outweigh the risks of if you needed general anesthesia to get the tongue tie release done, or other things like that? And so then I'm going to look, hey, what are the symptoms and what are the reasons why we're doing it? And then we can look at that. If they're going to be put under for other reasons, maybe the ENT is looking at doing a tonsils and adenoid removal, which I have different opinions on as well, getting the tongue tie done at the same time. So we always look to get the maximum benefits, the most comfortable, efficient, and effective means to get to where you're going. So then you're looking at the kid population. So getting your tongue tie release from 4 on up is a little bit more simpler in the office. And then, and why are the reasons, and I'll go over the reasons why I would do it at that age. And then as an adult, why would you do it at that age? So I think the answer is different for every age demographic, for every case situation. And you can't just say yes or no with different things. So I would do infants, and I actually refer my infants to go get a tongue tie release done at a colleague's because he has a IBCLC, a lactation consultant, in his office. And I'm like, that's the way to go with everything. If you could also get and maybe an osteopath or a cranio-sacral therapist on that team as well, then you're going to get better results. And so since he already has those systems set up in place, I send the infants out over there. So we're looking at the ability to suction, and we look at the actual physical length of the restriction and everything else like that, and breastfeeding. Then for the forward and up demographics, I'm looking, are you able to clean your teeth? If you have a lip tie that's so tight and you can't clean your teeth really well, we're setting you up for not having good oral hygiene. So yeah, maybe we do get that one done, and we look to see is that tongue. We talked about that tongue being the scaffold and getting up to the palate to help expand that palate. Well, can that tongue go up and help expand it? If it can, maybe we'll look at doing a tongue tie release then.
Thank you so much, Dr. Brittany. I really, really appreciate this. This has been so fantastic. So much great information, and now people know where they can get started. And if they want to come see you, you're in Alpine, Utah, and
Yeah.
they can get started.